Hello and welcome to this virtual presentation on fetal alcohol spectrum disorders. My name is Cherie DeVos and I'm the Prevention Programs Coordinator with ADAC Youth and Family Services in West Philadelphia, Pennsylvania. With September being FASD Awareness Month, we put together this presentation to do our part in furthering awareness of FASDs and contribute to prevention of them. So before we get into the content of this presentation, just to tell you a bit about ADAC, Anti-Drug and Alcohol Crusaders is a community-based grassroots nonprofit organization whose mission for 33 years has been to decrease the rate of substance abuse, violence, and other negative behaviors in the community by promoting making positive choices that lead to living healthy and productive lives for youth, families, and the community alike. And the way that we do prevention at ADAC is through education, so alcohol, tobacco, and other drugs education, also evidence-based curriculum, and also alternative activities through our OST programs with youth. So those might look like summer programs, after school and Saturday academy activities. We also provide resources and referrals to the community when needed. Okay, so let's take a look at what the objectives of this presentation are. So one, we are going to talk about and get an understanding of what FASDs are and the causes of FASDs. We're also going to talk about who is affected and in what ways. So what are the implications on health and on quality of life. Then 3, we're going to look at some treatment options that are available. And then 4, talk about prevention and resources that are available to decrease the rate of FASDs and also to minimize the challenges of those with FASDs. And then finally, we're going to talk about what you can do, what I can do, what we all can do to contribute to these prevention efforts. All right, so let's get into it. So what are FASDs? So fetal alcohol spectrum disorders are a group of conditions that can occur in a person whose mother drank alcohol during pregnancy. So this group of conditions can consist of fetal alcohol syndrome, which involves issues with the central nervous system, minor problems with facial features, growth problems, and problems with the central nervous system. So people with FAS can have issues with memory, with learning, with communication, vision, hearing, or they can have a mixture of these problems. So people with FAS also often struggle with performance in school, and then also with getting along with others. These can be a struggle for individuals with a fetal alcohol syndrome. And then we have alcohol-related neurodevelopmental disorder, or ARND for short. And people with ARND can have intellectual disabilities and problems with behavior and learning. So they might struggle in school and have difficulties with memory, with attention, with doing math in school. Then also can have problems with exercising good judgment and can have poor impulse control. Then finally, alcohol-related birth defects, or ARBD. So people with ARBD can have problems with organs such as their heart or with their kidneys, can also have issues with their bones or with hearing. Again, they can have a mix of these health problems. Okay, so what are some of the signs and symptoms of FASDs? So this is not an exhaustive list, but gives us an idea of what some of these symptoms might look like. So they can include small head size, abnormal facial features such as a smooth or flat ridge between the nose and upper lip. Can also include low body weight, things like hyperactive behavior, difficulty with attention, learning disabilities, delays in speech and language, problems with sleeping and sucking as a baby, vision and hearing problems, again, those issues with the heart, kidney, or bones, and in others as well that are not included on this list. So let's look at what is the cause of FASDs. So simply put, FASDs occur as a result of alcohol use while pregnant. So alcohol in the mother's blood passes to the baby through the umbilical cord. So there is no known safe amounts of alcohol during pregnancy. Research shows us that, and all types are equally harmful also. So this can include wines and different types of beers. All types are equally harmful, and there's no safe time during and throughout the pregnancy for a woman to consume alcohol. So if we take a look at this graphic on the side here, it shows us that about 10% of pregnant women drink alcohol in the past 30 days, as reported. And then about 1/3 of those women who reported drinking alcohol in the past 30 days, 1/3 of them binge drink. And then of those women who binge drink, they had an average of 4.5 binge drinking episodes during that time. So drinking alcohol during pregnancy also incurs a risk of miscarriage and stillbirth, along with these FASDs on which we are focusing right now. Okay, so as this speaks to the prevalence of alcohol use during pregnancy, we'll move on to look at who is affected and how. So we'll talk a bit about the impact, the effects of alcohol use during pregnancy. Okay. So who's affected? Those who are affected are people whose mothers drink while pregnant or while they were in the womb. So up to 1 in 20 U.S. school children may have FASDs. So this speaks to how widespread and how prevalent FASDs are in the United States. FASDs do last a lifetime. There is no cure. So people of all ages, not just children, not just babies, but of all ages can deal with challenges or a mix of challenges due to FASDs, due to drinking while pregnant. So we won't get into all the details that are in this graphic because we're going to look at them a bit later in the presentation, but just to kind of note some of those lifelong issues on the right of the graphic there, some of those might include school and social skills, so issues with those, also issues with living independently, mental health challenges, substance use and abuse, problems keeping a job, and then also trouble with the law. So these are some of the implications on health and quality of life that a person with FASDs can deal with. Okay, so to get a bit more further into how people are affected, what ways are they affected by FASDs? We have some ways listed here, unique challenges on each age group. So FASDs present lifelong challenges as there is no cure. So we've talked about that. There is no cure. So babies, adolescents, and adults can experience unique challenges. So if we look at babies, some of the challenges they may deal with are problems with feeding and sleeping, also being extremely irritable and really difficult to settle. So they'll have difficulty sleeping. You can also have tremors or shaking, diarrhea, right? And then to look at children, some of the challenges they may face are learning disabilities or difficulty with attention. And as we already looked at, hyperactivity. And then also poor communication in social settings, poor reasoning and judgment skills, and then also problems with impulse control. And then when we look down to the teens and adults, some of these overlap here. So teens can have mental health challenges, negative school experiences, trouble with the law, drug or alcohol abuse, and inappropriate sexual behavior. And pretty much all of those carry over into adulthood. But also which will be more applicable to adults would be difficulty keeping a job. So while this is a disorder that may show up in early adolescence, can have lifelong implications for people who are exposed to alcohol in utero. Okay. So while there is no cure, there are treatment options out there. So there is hope. There are treatment options, and research has shown that early intervention treatment services can actually improve child development and can improve quality of life. So some of those types of treatment can include medical care, certain medications, also behavior therapy, behavior and education therapy, also parent training, so training parents of children with FASDs to help the children meet those challenges. And then it's important to note that no one type of treatment is going to be right. It's going to be a good fit for every child. One treatment cannot be used for every case. So it's important to develop a good and quality treatment plan, and also to closely monitor and to follow up with that child, and make adjustments in the plan as necessary to really make sure that the child is able to live out to their full potential. So in addition to these treatment options, protective factors can also help to minimize the effects of FASDs. So protective factors are sets of conditions or attributes that are present in people or individuals, families, communities, or society at large. They can help individuals to deal with stressful events, right, and to kind of minimize or alleviate or eliminate some of the risk in families and communities, right? So some protective factors that can also aid in challenges faced by FASDs are a diagnosis before age 6, living in a stable home environment or an environment that is loving and nurturing to the child, also where there's an absence of violence in the home and community, and then also special involvement in special education and social services. All right, so now that we've looked at different treatment options that are available, let's talk a bit about the larger response to FASDs, and what is being done to decrease the rate of babies being born with FASDs. So when we look at prevention, there are a number of prevention efforts that are taking place concerning FASDs. So it's important for us to know that FASDs are 100% preventable if a woman does not drink while pregnant. So a woman should not drink if she's pregnant, if she thinks she might be pregnant, or if she's trying to get pregnant. So prevention can also look like educating women of childbearing age, of educating their partners and families and friends, because they also have an influence over a woman's inclination to drink. So having a supportive system around her that makes sure and holds her accountable that she does not drink while pregnant, to ensure the health of the baby, can be really helpful as well. And there are also a lot of free tools, trainings, and educational resources that you can find from credible sources on the internet, different organizations that educate the public about FASDs and the dangers of drinking while pregnant. There's also an excellent resource directory by NoFAS, or the National Organization on Fetal Alcohol Syndrome, and it provides support by state that you can find. You can find the support nearest you to learn more about FASDs. Also, if someone struggles with stopping drinking, this can be a great resource. And then also, consistent, clear information from healthcare professionals is really, really important when speaking to women about the dangers of drinking alcohol during pregnancy. And then universal alcohol screening and counseling can help as well. So following up, screening women, counseling, informing them about the dangers of alcohol use, also following up with them at appointments, really keeping tabs, and also referring them and providing resources can be really helpful. Okay. So let's look at some of the resources that are available. We mentioned that briefly. So a number of resources are available for education, prevention, and intervention regarding FASD. So the National Organization on Fetal Alcohol Syndrome has an excellent resource directory, which I just mentioned. And then the National Institute on Alcohol Abuse and Alcoholism has a treatment navigator for women who are pregnant and need help to stop drinking. And also for that same purpose, SAMHSA has a behavioral health services treatment locator, and these can be accessed through these websites here, those URLs here, to find those really great resources. So what can you do to further prevention of FASDs? What can you do? What can I do? What can we all do as members of the community? We can educate ourselves. We can educate ourselves about FASDs and also share factual information and also be a positive source of support for women who are pregnant. To make sure that they have support with not drinking during pregnancy. If they have a problem with drinking, to share resources with them, and to encourage them in positive ways to stop drinking for the health of their baby. And then also sharing helplines with them. So those resources that we looked at in the previous slides are also finding a helpline that someone that they can talk to about their struggles with alcohol use. And then also importantly, avoiding blame and shame in our support of women who are pregnant. So not approaching prevention from a place of shaming women who may have an issue with drinking, or also placing blame if we know an individual who has an FASD, but really just kind of looking into finding positive ways of support, supporting women who are pregnant, supporting individuals with FASDs, sharing information, educating ourselves. These are positive ways that we can approach prevention. Okay, so lastly, we're going to wrap up, and I do want to say thank you for tuning into this presentation. Hope that you were able to get some really good information out of it, and understanding of what FASDs are, understand what the causes are, and what we can each do which each of us can do to contribute to the prevention efforts, to contribute to the decreased rate of FASDs, not only in the United States, but globally as well. So please, going forward, please do share this presentation with your family, with your friends, and start the conversation about the effects of alcohol use during pregnancy. You can also share other resources that you can find online on social media, as this is FASD Awareness Month. There are some really great tools online that you can find and that you can share with your family and friends as well. Okay. So these are the sources that we used for our presentation today. If you'd like to read up more on them. And then finally, how you can contact us. So there are a few ways that you can reach us. Here's our address, ADAC Youth and Family Services. And also you can reach us by email at info@adacphilly.org. You can also call our number. It would actually be better to email us, considering the current situation, we're not being on site. But you can call us, you can email us at info@adacphilly.org. You can also contact us through our website, adacphilly.org, by filling out a contact form. You can also reach us on social media. On Facebook, we are ADAC Youth and Family Services, or you can find us by typing in ADAC Philly. And on Instagram, at ADAC Philly. And we're also on YouTube, ADAC Youth and Family Services, where you can find a number of curated and original content, curated playlists and original content that focus on education, prevention, also activities for the whole family to keep kids engaged, to keep families engaged during this time. So again, thank you all for tuning in to this presentation. Really hope that you were informed, that you got something out of it. Please do share with your family and friends, your community, your colleagues, etc. And do stay safe. Have a great one. Thank you.